Welcome back. You're watching KBC Channel 1, the channel that gives you the most comprehensive news coverage in Kenya, and you are watching the Legends editions. My name is Catherine Kasavuli, and on to our news on the malaria vaccine. Scientists at the Kenya Medical Research Institute KEMRI Centre for Global Health Research are in a race to find out if malaria is a risk factor to persons suffering severe COVID-19 disease. In a twin study in Kenya and Burkina Faso, dubbed MALCOV, scientists are seeking to establish the relationship between malaria and COVID-19. Mari Yambo spoke to Dr. Brian Tangara, the lead researcher for the MALCOV study at KEMRI Centre for Global Health Research in Kisumu County. In the face of COVID-19, experts are seeking answers on whether malaria can complicate instances of COVID-19 infection. The MALCOV study is being conducted in multiple sites in Kenya and Burkina Faso. In Kenya, the study is being conducted in high malaria burden regions of Kisumu, Siaya and Busia counties. Dr. Brian Tangara is one of the researchers.
We live in an area where malaria is endemic all throughout the year. And we've been trying to manage, using several interventions to manage malaria. But they're now compounded to COVID-19 that caught the world off guard. So we went forward and we want to understand that is malaria a risk factor to COVID-19? You having malaria, does it increase the severity of COVID-19 or does it reduce the severity of COVID-19?
Malaria weakens the immune system and, if not managed, can have serious health implications. Nancy Olo, Director Nursing Services at the Kisumu County Referral Hospital, paints a picture of the devastating effects of malaria in this region, perhaps the reason doctors are not taking chances as to what the effects of the disease could be on COVID-19.
Used to have very many people coming in with severe cases of malaria. Some of them would even come in convulsing. Some of them would even come in with severe fever. The body is just too hot. A lot of babies also used to come with severe anemia. In a whole pediatric ward, you would just see, the nurses doing blood transfusion.
Kisumu at one point had a positivity rate of 28%. That means you're saying out of every 100 people, 28 people have COVID. If you're getting a region like that, it has high COVID positivity rate, and then you also have the same region having high malaria positivity rate, then you want to understand how the two interact.
Sampled from government facilities in Kenya and Burkina Faso, 708 participants, all with COVID-19, will be monitored for a period of 1 year. In the initial 2 weeks, the patients will be given a thermometer and oximeter to monitor their temperatures and oxygen saturation, as COVID-19 tends to lower oxygen levels. Of the 708, some will be co-infected with malaria.
We also want to understand, you having the virus, if you have malaria, do you shed the virus more quickly or less? We're also interested to understand that you having malaria, do you remain more infectious with COVID-19 or less?
While the observation group infected only with COVID-19 will receive the standard COVID-19 care, the ones with malaria will receive 2 different malarial drugs, artemether lumefantrine or Coartem and pyronaridine artesunate.
Pyronaridine artesunate, which is Pyromax, it's also a known anti-malarial drug, and is actually shown in the lab that it has active antiviral towards SARS-CoV in vitro in the lab. Now we want to compare you taking those 2 anti-malarial drugs. Do they have an effect on COVID-19 severity?
The results of the 18-month study are expected mid-next year and could lead to other effective programs to manage COVID-19 and malaria.
If we find that receiving this anti-malarial is going to reduce COVID-19 severity, that's what we're saying, that possibly in the future you may only have to take one anti-malaria and you do malaria and also do COVID.
And what will be the resultant impact?
It means that if we come to establish that there's even a slight change in the risk of COVID severity due to the infection of malaria, that will be a game changer for us to understand the impact of COVID-19 in our region. The other thing will mean if you find that you having malaria, you tend to have less severe COVID-19, then it means if we successfully control malaria, we can potentially control COVID-19.
The researchers will also be conducting genome sequencing to ascertain whether the recently identified Omicron or Delta variants are at play. And just like the malaria vaccine, the results of this study will be a game changer in this region and could inform global policies. Maria Yambo reporting for the Legends edition.